Welcome back to another episode of the Yoga Well podcast. I'm Chase Bossart, Executive Director of the Yoga Well Institute. Today, I have a longtime friend and colleague and student, Dr. Gurjeet Birdee, who is an associate professor at the Vanderbilt University Medical Center, and he is the director of the Osher Center for Integrative Health. He practices integrative health at Vanderbilt University, also performs clinical research on integrative health and modalities. And Gurjeet and I have participated in a number of Dr. Birdee's yoga research projects. He's also a board certified physician in internal medicine and pediatrics. So nice to have you on the conversation today.
Thanks. I appreciate having the time to spend with you here.
So I thought it would be interesting if we had a discussion about holistic health. So you're the director of an integrative medicine clinic. And the whole idea of integrative medicine is kind of new and difficult. And I wanted to get your opinion on it. What do you think of integrative medicine?
I think the most broad definition, Chase, of integrative medicine is a perspective of health that isn't focused just on the health condition or disease process, but really takes into account how a disease might affect different parts of someone's life, and vice versa, how different parts of someone's life might affect a disease process. And so the most global definition of integrative health is how do we look at someone's well-being in terms of all the factors that contribute to someone's health? And that's not just having a disease or just having a procedure. That's one's mental state, that's one's lifestyle, that's one's social circumstances, that's one's economic situation, where they live, etc. These days, I think environment, global health is something we recognize. And so that for me is the broadest definition of integrative health. Now, there are other definitions in terms of what integrative health might be, but as it relates to holistic health, I feel like that's a good description.
That's a fantastic description. Are there models? I mean, is there a model for integrative health that is dominant in Western medical facilities?
Well, there's many models. I think in practice, people often will divide someone's health into several categories that are useful. And so, for example, one of the ways people categorize integrative health is they'll look at, okay, what is the capacity for physical activity and exercise? What is nutrition? What is their social support? What is their spiritual well-being? What is the status of their mental health? And so they're sort of divided up in all of those pieces and how they are aggregated. So that's a very common model. I think there's variances in all those components. More broadly, though, if you were to ask me, really, and this goes back 60 years, that with the idea of a biopsychosocial model, which I think is the predominant model. And I think it's still a useful model to think about, does this fall into any of those three categories in terms of biological, psychological, and social? As it relates to Western medicine, I think that is the easiest model to start to look from.
How does that work on the ground practically in a integrative medicine facility?
Well, it really starts with when you start talking to a patient, right? Because what we're trying to do is capture their whole health. By the way, that's a term now that's gaining more favor even than integrative health, is this term whole health, which is same thing, same idea.
They
new
don't mean like a
decade, new
donut.
century, comes up with another term. And so this idea of when you talk to a patient, you really want to do a comprehensive intake to all aspects of their life, right? So someone might come in for foot pain, right? But you do want to address other things that might be related to foot pain, right? Like, do you sleep at night? Does the pain wake you up, right? Like, when does the pain occur? And so just taking a global assessment. And so really, when someone comes to you talking about their health, you make sure that you're getting those other factors, which is mental health, which is nutrition, which is sleep, which is diet, which is their social situation, their social support, in addition to examining them physically, observing them in terms of their mental state, etc. So you really get a holistic picture, and I think that's the way that looks. I would add one more feature, I guess, as we start talking about integrative health that's really important is integrative health is really values the relationship between the provider and the patient. And a lot of this is akin to how we think about yoga and Ayurveda, right? That this relationship is really important and it should be patient centered, right? So it isn't as much as the healthcare provider is the center of knowledge dispensing specific treatments, but really helping the patient, using the patient as a center in terms of identifying what their experience of disease and processes and how they're prioritizing their health. And I think that that's a really valuable perspective of integrative health. And I think in general, all good forms of health, including things like yoga therapy and Ayurveda, is really identifying from the patient's experience what's going on with their health and how it's affecting them.
Yeah, I mean, as you're talking, I'm just thinking like this is so common, or so there's so much overlap with yoga and Ayurveda in terms of how it's being thought of. So how do you use yoga in the Institute?
It's a great question. And at our center, we have a multidisciplinary team of different types of modalities. So, we talk about integrative health being this idea of holistic health. And then there's another definition, right? Which is you don't use just one approach, you actually use multiple approaches at once. So therefore, integrative health is multidisciplinary. And to some degree, if you think about it, that makes sense in the West because people train in silos and have specific skills and expertise. And I would even argue that often specific perspectives or lenses through which they operate, if you will. And what happens in integrative health is you have people with different training and therefore different perspective and lenses that then come together to come up with a treatment plan that is holistic. And, I think it is an interesting premise that you treat someone with different lenses versus there's also the idea of holistic medicine from a single lens, which is different. So on our team, you asked how yoga therapy applies in our center. So a patient might come in, usually people get an initial consultation with myself or a nurse practitioner where we do an initial intake. And then we come up with a treatment plan saying, okay, we think this person needs to do some physical activity, they need to change some lifestyle, and they need stress reduction. So we want to do that by giving them acupuncture. We're going to have you do some physical therapy, and we're going to have you do yoga therapy, right? So now someone that gets acupuncture, someone gets physical therapy, and gets yoga. This is very interesting because
I think it's
now
fascinating.
Someone's getting 3 different perspectives. It's not holistic in the sense that the models are harmonious. Acupuncture comes from traditional Chinese medicine with its own thousands of years of philosophy. Physical therapy is born out of Western science, looking at kinesiology, anatomy, and physical exercise culture. Yoga is thousands of years old, coming as a spiritual tradition and a sister tradition to Ayurveda. So now let's take these patients and have them have all 3. I don't mean to be biased, but it's a very Western concept to actually try to lump different perspectives together because, we're in a culture where potpourri or the soup, a mixed soup is better. I think the verdict is out if it's a better perspective, but in fact, that's how holistic medicine is practiced at our own center. It's an amalgam. Where the challenge lies right away is reconciling the models. So, there are different ways because obviously the way that the physical body is looked at in physical therapy, there's going to be similarities to yoga, similarities to acupuncture, but there's going to be inherent differences. As someone who has studied with you, we often talk about models and you'll say, well, this model over here stands by itself. Don't get confused with this model over here, right? So now, and that's within the same South Asian subcontinent
Yes.
culture, right? So now
Yes.
imagine different cultural models. So obviously one of the things that we benefit from an integrative health model that's multidisciplinary, we spend a lot of time having conversations about patients and learning from each other's models. Sometimes there's a discussion about creating a common vocabulary. I don't know if that makes sense, to be honest with you, a common vocabulary. I mean, I think there's value in it, but a lot of this is embodied experiences and ways of thinking that maybe need not be reconciled. I think where it's interesting is that from a patient experience or a client's experience, what happens when they go to these different systems? For them, it's useful because they can get tools from different cultures, so they can take sort of the best. But it doesn't mean necessarily that the combination of things is more efficient than one of them alone, or one may be superior or less. I think that that's an interesting notion, but not necessarily the case, right? Like, we don't know. There's no research to support that combining acupuncture with yoga is better, right? Reconcile using two models. I think there's a hope that more is better, maybe. But the downfall is the confusion for the patient. Because what happens is their experience may be very disjointed because they go see one provider and they say, your problem is blockage with qi. I'm going to give you needles. This has been used for thousands of years in China. And then go to the physical therapist and they say, the problem is your posture. You've been sitting this way and it's causing structural problems. That's therefore your legs aren't working as well. Then they go see the yoga therapist and then the yoga therapist says, the problem is prana. And it's because of the way you're breathing. You need to breathe deeper and smoother. That's like a whole multicultural experience for the patient, if you will, right? From each perspective. And I don't mean to criticize my own field, but I think, if we're talking about models, it is interesting to think how these models are juxtapositioned with each other and how they work. And I challenge the notion that we need to make a supermodel, if you will, that integrates everything.
Yeah, I think that, that's the temptation, is that we'll be able to find a particular way of describing how the human system functions that accounts for all of the very broad philosophies and ideas that are underlying all these different techniques. One of the things that I see when we're training yoga therapists is that inevitably they start getting clients that are also seeing PTs. And the client comes to them and says, oh, well, that's the same thing that my PT gave me. Or, oh, yeah, my PT is also had me doing something like that. But when you push a little bit further with the client, there may be shape similarities. There may be some some ideas that overlap in terms of structure and whatnot, but the actual process and the way that um, the client is being asked to do the different things are really different. And
agreed.
So I say a lot in these trainings that what you do does not make you who you are. Why you do what you do makes you who you are. So we're coming back to a question of intent or motivation, and that you just touched on that. So the client is sitting there, and the Chinese acupuncturist is talking about qi, and the PT is talking about posture and structure, and the Chinese, and the our yoga therapist is talking about prana and breathing, and not that the PT is not interested in breathing, and not that the acupuncturist and the yoga therapist don't see structure, but that the foundational principle, or the cause of why something is having this expression is really different. And in our trainings, in when we're training yoga therapists, we emphasize again and again and again, be a yoga therapist, which means operate from yoga principles, which means you have to know and understand what were the anatomies, what were the physiological models that yoga developed in concert with. Because, like an X-ray machine or an MRI or whatever, that was not around when yoga is being developed. And, for me, there's a fundamental divide where yoga starts with the idea that you are a spiritual being in a material container. And allopathic medicine really starts from the position that materiality is all there is, right? So we have one system which is starting with the idea of a something beyond materiality, and we have another system that's starting with there's only materiality. Whoa, that unfolds in really the really important and distinct ways. So practically, we get with yoga, we really care about the breathing, especially as it relates to shape and structure of the body. So we may be asking people to do something that looks very similar, even identical to what their PT is asking them to do. But the way that we are asking them to do it is really different. So it comes down to these things are processes, not, these things are verbs, not nouns, right? So we're going to think about what is medicine, what is a health interaction. We're thinking about an activity, not a thing. And to then understand, well, what is the foundation and the basis of the activity is super important. And then you come to loggerheads. Like, there is no way around for allopathic medicine that spirit is unmeasurable and therefore unaccountable. You can't take it in. I mean, I see that you may not be agreeing on that. So what's your opinion?
I do agree. And I think, one of the things integrative health tries to embrace is the idea of spirit and spirituality as part of one piece of their health. But that doesn't necessarily mean it's implemented that way. Like, acknowledging it is different than having ways to implement it. And I think there's a difference between lenses and perspectives versus tools and scope of practice, right? So, the interesting thing about acupuncture, TCM, yoga therapy, and Ayurveda is that they in themselves are complete health systems.
Right.
Like, they are holistic systems.
They are, yes.
Right? Like, you can go in India and you get sick and you can go get everything from an Ayurvedic provider. Now, this is TCM, Ayurveda, or Western medicine. This isn't saying one is effective or not. I'm just saying that they are complete perspectives.
Yes.
That is very different in the West, where, generally speaking, outside of integrative health or whole health models, people will go seek a specific treatment from a provider that is focused on one thing that is not holistic, right? Like, you have a heart problem, you go see a heart doctor. You have a hip problem, you go see orthopedics and then get PT, right? Now, when you mentioned like the PT yoga contrast is so interesting. And also, mind you, I work with really strong physical therapists that are super integrated. I mean, they can get things out of people in ways that are really quite magical, right? And what I think is really important or has been valuable to me from yoga is to recognize that yoga is a very powerful perspective on health. It's a tool to see someone's system and to see other therapies. But it doesn't necessarily mean I have the skill set of all those treatments, but I can see in a yoga lens where each treatment lies. Does that make sense?
Yes. Yes.
For example, I work closely with psychologists that are teaching me amazing stuff all the time. And it's really amazing how much the West understands the mind through neuroscience and through theory and research. It's amazing and it's sophisticated. It's really sophisticated. The South Asian systems of the mind arose out of a different context and different perspective. And they are also really sophisticated and complex, but not, they're different. And yet, when I hear the models of the Western mind, I can put them in the context of yoga. I would say, oh, yoga would say this is, self-determination theory is one of these very common concepts in health behavior and psychology, right? And I'm like, oh, that approximates Shraddha, right? Like this idea of following yourself and how you can determine things in your life and your self-efficacy. Like it follows that construct. So for me, it's very useful to see what people are doing and then look at it through a yoga lens and then have the intellectual flexibility to look through other lenses and see different things. Now, I have different training and everybody has different training, and it's always useful. And then there are people who are purists that see things only through one lens, but they still understand that this lens, and I think this is important, is taking a step back with whatever lens you have and saying, okay, this is just a lens. This isn't the truth. Right? Like, and like, I think you were talking about like, okay, allopathic medicine is never going to recognize the spirit, right? And at the same time, the lens of yoga lets you follow, well, what will be the consequences of treatments if that's not the case? Right? Like, how do you apply a yoga lens to that model?
Yeah.
Like, right?
Yeah.
And it's really useful because when a client comes to you and they're getting chemotherapy treatment, and they're like, yeah, I'm getting chemotherapy treatment, but I have decreased energy and I am depressed. Yoga has a perspective on that, right? And so does psychology. It's a different lens, right? The biomedical person will say, could be the cancer, it could be the drugs you're getting, probably slowing down your system, not getting good sleep, right? And also the stress of what you're doing, hard to say, here's a drug. But yoga would have a different perspective and assessment of that situation, right? Like it's a different lens, which is really beautiful. So I think, this conversation of, what is integrative health also for me is a question or a conversation about how we use models when we think about health conditions and health problems and people, when we're trying to help people or help ourselves. What is a model? How do we use it? And what are recognizing that a model is just a model, it has limitations, it's going to be contextually framed, culturally framed, and can be so powerful and useful for different people at different times. But just taking a step back and recognizing that is very, very important.
I think that is actually the key piece that is, at least from the outside, missing in these integrative medicine discussions. Now, probably they're there, but what I constantly run up against is that yoga, it's not even understood that yoga has its own models of physiology. It's not even understood that, it's just like when you say liver, that, well, of course, that this is what the liver does, etc. But first of all, there is no word liver in Sanskrit. You have different words, right? And those different words have different connotations about what means and what is happening. And you know, from what I see is that people without training in yoga don't even have the awareness that we're operating from a particular model and just assume that we're operating from the biochemical model of
Yeah.
allopathic medicine, and that therefore our techniques get reduced to what their own possibilities are for movement in, you know, in that
It's a
model.
very good point. And so, coming back to the earlier question, you're like, well, what does yoga therapy look like at our center? And it's very interesting because basically it's a microcosm of seeing how this lens and model abuts other models and systems in a medical center, right? And the yoga therapists struggle. They struggle because what they feel is that because people don't understand the model, right? Completely, it's their practices are dismissed as simplistic, right? And
By both the client and the other therapist.
yeah, everybody. And it's a really interesting thing. So I'll give a very concrete example. And it'd be interesting if anybody at our center listens to this podcast and this triggers them. We'll have patient conversations and discussions, right? And something will come up about a patient that, when you see a patient that's it could be physically or emotionally depleted. So emotionally, it might be that they spend all their time taking care of other people, and there's very little self-care, very attention to themselves to build up the strength and capacity to continue doing what they're doing. And so over time, they become depleted, right? In the sense that everything is external to them and there's not too much time to focus on themselves. Very common thing for many people, many patients, many people. It also might be that, get another scenario of that would be on a physical level. Someone who has a lot to do or a lot of stress and is physically exerting themselves constantly, right? As a either because of work or because of life, or maybe perhaps because that's how they deal with stress. So once again, they're fatigued. They're physically unable to do things. So the idea of doing something is so difficult because at the end of the day, once they have everything that they've done, they have no energy, right? So to characterize the symptoms, this is not saying a specific condition, but imagine someone is fatigued, lack of motivation, feels like they're running low emotionally and can't give any more to people, right? Because all they're doing is caring for other people, like these kind of characteristics. So often, like a psychologist, they have a great model for analyzing these different situations and actually really, really specifically thinking or conceptualizing what that individual's problem is in their model system, right? And even there's various psychological schools of thought, but they have a process for that. And then yoga has a perspective, and we would sort of identify, okay, well, what's the problem, right? And so in English, right, the word would be like, oh, well, this person is rather depleted and needs more nourishment. So our yoga therapists often will talk about a case, which these kind of symptoms come up a lot. They're like, this person needs nourishment. They need to find nourishment. And so they'll give a practice that is all about self-care and taking care of oneself and replenishing oneself, right? Giving someone internal prana is how we would concept. So we have a conceptual model of that. It is deceptively more simplistic thinking than what a psychologist would come up with. Very much so. So much so that when a yoga therapist uses the word nourishment at our center, it triggers and pisses off the psychologists. And they're like, oh, here they go. This person needs nourishment. Everybody needs nourishment, right? Like, but from an Ayurvedic standpoint, when we're pacifying conditions, often what we're starting is with nourishment, right? We're often trying to figure out, oh, how's this person consuming and getting energy? Is it through food? Is it emotionally? Is it through what they're seeing through their senses, through their taste, right? Because if we're going to replenish them, we have to go foundationally to give them more prana. Where does prana come from? Well, it's what we consume and how are we consuming. So there's that model. But when they hear nourishment, it sounds so deceptively simple that they are actually offended by the model. Now, when they hear it, they don't have the context, the broader context of where that comes from, right? And it also abuts 10, 12 years of training where they would thoroughly analyze and come up with a beautiful model of what the treatment plan should be for a patient that very well might be effective. But yoga doesn't have those other tools in those models. Yoga has this model. And it applies to these tools, right? So that's an example. And, I see this. I see this in our center.
Yeah,
I'm sure
I
you have
want
some
to.
thoughts and reaction to
Yeah,
this.
yeah. I want to. I just want to. It is such a common experience for a yoga therapist to have someone come in with something very complicated that they have been to a lot of already established medical providers, and they'll get a very simple practice. Simple means from the perspective of the client, they're not doing anything. They're they're moving their arms a little bit. They're doing some breathing. Maybe they're saying something like this. So the client looks at it and thinks, how the hell is this going to help me? I'm not doing anything. And yet, from our yoga perspective, it's actually a very sophisticated practice, which is utilizing different dimensions of the human system. It's using the physical, it's using the energetic, it's using the mental, attentive, it's using sound, etc. So it's actually drawing resources from more than half of the human system's capacity in order to address the physical issue in a very specific way. So it's never just do some breathing. It's always breathe like this with an emphasis on this breath. So from one perspective, without the training of the yoga practitioner, it's like, what the hell is this? But from the yoga perspective, one of the things that we actually talk about in our trainings all the time is that the most complex practices are the ones that are the simplest. In other words, simplicity is a value of ours where we are training people to incorporate a huge number of things into and boil it down and capture that in as few motions and few techniques as possible. So from our perspective, this is like a masterpiece practice. It's so simple. It's so straightforward. This person can easily access it, etc. And it's like looking at those in the Japanese Zen tradition. You have this great artwork with simply a drawn circle. Right, that's it. It's just one line in a circle, and it's like the masterpiece because, like, it's the hardest to
it's so
draw.
well said. It's so well said because I think, you said simplicity. I would add the feature of efficiency, right? Because people, I find it very interesting that we give people a lot of practices at our center because they see 6, 3, 4 providers. And, people can only access so much in a day. If you add suffering on top of that, your capacity to do something is diminished, right? So my
Greatly.
experience is that the more complicated treatment is, the less likely someone's going to do it, right? Also,
hold on. That's a huge piece right there, right? So it's important for the treatment process that the client is given things that they can actually access and do, and that's another reason why, from a yoga perspective, we're giving these things that appear to be simple, right?
Right. And I think it's interesting because when we look at let's say we take any treatment, we're agnostic of what it is. by virtue of giving someone a treatment, regardless of what it is, they're going to benefit some because you've given them the attention and time. Maybe you call that placebo. There's a social interaction, then that's that, right? Then if you follow up, and this actually is in a lot of research, if it's a behavioral treatment, right? A lot of times people don't do it. There's a lot of research studies where they have behavioral treatments, and I'm not really sure that people did it. But they
so
gave
then
it to them.
You're not measuring the efficacy of the behavioral treatment because they didn't do it.
They didn't do it. And if they did do it, how do you know that actually caused a difference? It's just like drug studies, right? Someone takes a drug. How do we know the drug made them better? So then you have to do clinical trials and all this stuff. I do want to say something, though, that's really important is this. And this is something I've been dwelling on more as I look at a lot of research, is especially behavioral research, where there's a very strong idea that a lot of different behavioral treatments work. And sometimes they work in ways that are really magical in the sense that I'm not sure it's what someone was doing. It's more that in their head, there's an idea that they learned something that they're doing. Well, what does that mean? So let me describe it differently. Let me say that I told you, you come into me and you have a significant heart condition and your diet is terrible. And I say, you know what you need to do is you need to eat more vegetables. And I'm going to teach you all about vegetables. Yeah. These are the vegetables that are good. This is what you do. This, that. So you go to Whole Foods, you look at the vegetables, and you go a couple times, and maybe you buy some more vegetables for a month. But then actually, if we look over the year, right? You didn't really eat that many more vegetables. You just adopted the idea of eating vegetables. And guess what happened? You started to associate yourself as being a vegetable eater. What is that? That is an identity shift. That is a shift in how you are perceiving yourself, that now I'm a vegetable eater. You actually didn't eat vegetables. Guess what? The same thing happens with meditation. People who take mindfulness meditation after 1 year, very few people are doing mindfulness meditation. But if you ask those people, I'm a meditator. People who do a couple classes of yoga are yoga experts. And hell, you can go onto YouTube and learn anything now.
Yep.
I'm not diminishing what people get out of these things. What I'm saying is actually maybe treatments are in part about the treatment, but it's also about a switch in identity. And when we're giving these really simple practices that are changing someone's pattern on a subtle level, what we're doing is we're shifting identity intentionally, right? We're disrupting the construct of the self.
Well, from a yoga model, this
from
is
a yoga model,
specifically what we're talking about. Yes,
we're putting a spoke in the wheel of consciousness to reorganize them in a healthier pattern, I would say.
That's right.
Right?
Yes.
And that doesn't mean it doesn't happen in other treatments. But from a yoga lens, and this is where this gives a good example of how I think about things, right? Yep. I think about things and how they work. And then I say, well, what would yoga think about this? And yoga would say, oh, you didn't do the treatment, but there still was a change. There was a change in your ahamkara. There was a change in your identity, in your perception. And that has an implication on every level of your system, your mind, your breath, your body, emotionally, and your personality.
That's
right. Because now I'm a vegetable eater.
Yes.
Right.
And your whole system reorganizes around that identity. That's exactly right.
So guess what? Hold on. Look, guess what? You take someone who thinks they eat vegetables, take them to a steakhouse. What do? Their body won't be able to digest the steak and they'll vomit and have diarrhea. That is a physiological consequence of a change in identity.
That's right.
Right? Like there is something inherent about that, right? Like actually, if someone doesn't eat meat, you actually produce less enzymes to break down meat. But that's based on your identity. Like, I mean, I think it's actually a really good example. I'll give credit to myself, right? Like identity shifts physiology as a consequence of health behavior. And what I find so fascinating about yoga is it is about identity. It is about shifting that identity of the self, right?
It is. Yeah. Well, I mean, this comes back to what we were just saying a moment ago, which is the sophistication of the yoga model is not understood. And it is not easily apparent in the kinds of practices that we give because the quality or the emphasis is on simplicity and we're trying to design practices so that they can be as efficient, in other words, as short as possible. And so an enormous amount is being covered in a very short period of ground.
Yeah.
And it's hard for people who are doing it, or for other practitioners who have their own history of, years and years of study, et cetera. And this is the same thing about yoga.
And yeah,
It requires years of study. I make
yeah,
this joke at the end of our 4-year-long yoga therapy program. Okay, now you're qualified to begin studying.
yeah. Right.
We've given
Right.
you all of this stuff. We've
Yes,
and
absolutely.
so many experiences personally, and what you've taught, and all of this information, and all of this structurally, how to think about physiology, and how the tools plug into that, and and how to make that efficient and simple, and blah blah blah. And that takes years and years and years to come and get anywhere. And then you give it to a client and they're like,
Yeah.
okay, so they do it, and all of a sudden their neck has no pain, and they're like, it doesn't compute. So they come
Right.
back to
Yeah.
you a week later and you say, so how's your neck pain? And they're like, well, I started drinking the XYZ tea and I have no more neck pain.
Yeah.
And you're like, well, did you do the practice every day? They're like, yeah, I did the practice every day. But this tea, you're like, F the tea. The tea had nothing to do with it. This yoga practice that you just did for a week,
Right.
and
Yeah, and I do, I as we talk about this, I do want to say that I wouldn't say that yoga is the be all and answer for everything,
agreed.
right?
Agreed.
Like there are limitations and everything.
Yes.
But what happens is the simplicity, I agree, is so deceptive. And your point is really well taken, where I see people, a lot of people come in and their cup is full. So I'm like, okay, what do you do? Oh, I meditate, I do yoga, I meditate. Well, what do you do? Well, I do, 50 minutes of asanas in the morning. Then I follow this person every morning. I listen to this meditation follower. And then I do yoga nidra at night. And then, and there's like a lot of practice. Okay. Tell me about your stress. I'm so stressed out. Right? Like you're spending 3 hours, right, doing all these things, and it's not working for you. And so, you mentioned, like, it's interesting because it's bimodal, right? There are those people who don't do anything and you give them something small and it's dramatic, but they're like, it can't be that. Then there are people who are so full and you have to give them something and replace it. And for them, it's hard to let go of what they're doing and the idea that actually less is more. Let's be honest, right? If you're an efficient meditator and you meditate and you can focus and shift your identity, you need not even practice. Those are the people who fall from the sky, right? That it says in the Yoga Sutras, right?
Yeah.
And you meet those exceptional people. You're like, what do you do in practice? And they're like, oh, I don't do anything. It's like, this is in your nature to be this person, right? And so I think it's interesting when we give, like when I'm giving someone a long practice, it's because they feel they need a long practice rather than usually they need a long practice, right? Because you have to not all the time, but a lot of times it's like, well, we gotta keep this mind busy and make them feel like they're doing something. But the metaphor of art is wonderful, right? But I 2 more points around this, right? Is that one is that art is subjective. So when you give someone a practice, it has to meet them where they are. So the length, if they're not going to practice it, be it short or long, we create a practice that meets their needs, right? And you've taught me this, that a lot of times people who are very physically oriented and want a physical practice, you have to give them that physical practice to get to a practice where they might get something out of it over time, because it's subjective. And so for them,
Yes.
the art of yoga is really in that physicality, and you have to over time introduce different ideas.
Yes. I think this is a part that is also poorly understood from outside practitioners, but which we talk about a lot in yoga, which is that yoga is a science of experience. It's a science of the way that your experiences, they could be physiological, they could be mental, they could be emotional, they could be behavioral, etc. It's how those experiences influence the way that your system functions. Our techniques only work if they generate the experience that we have in mind for the person. So we can't just give somebody a pill because they, like they take the pill and then it does for their system what it's supposed to do. What we have to be able to do as a teacher is to understand what portion of the experience that will be useful to this person can they do? And then give them and teach them that portion. When we're working with somebody, we're thinking about they need to have an experience. What are their capabilities right now? You can't just tell somebody, do this complicated breathing because they can't do it. And so, therefore, that's an inaccessible medicine. So we have to start with a place that they can actually access. Then it's not only that you start where they can access, but you have to start where they're willing or interested to do it because you're asking them to have an experience. If they're not engaged, if they don't think it's interesting, if they think it's too hard or too easy or too anything, then they don't do it. Then they don't have the experience. Then it doesn't actually work except this other place that you're talking about where people have the shift in their identity about like, well, I'm a meditator, etc. Right? So working with these people, we have to figure out what it is that is their beliefs. Do they think that physically moving their body is going to be helpful? Do they believe that there is a higher power or not? Do they have some place that has been very important in their life that was like really nourishing, to use the word, or really calming or whatever, etc. So we have to like actually delve into who the person is to understand what the workings of their perception are, what their mind is, in order to be able to give them effective medicine. And I think that this whole process you can't see from the outside. It all that you see is like, simple this and this and that. And it's like, oh no. This is so wildly sophisticated because I'm actually I'm dropping my own patterns. I'm dropping my own preferences. I'm dropping the things that I want to do or that I think are great. And I'm entering you and feeling, well, what are my interests now? And then marrying that with what I know as a therapist or as a client as will be effective, and creating out of that some kind of marriage of the two. Very sophisticated, very challenging to do. It takes years to get there, but also highly effective. And frustrating when they come back and the client says, I started this new tea, or I quit eating XYZ, or now I'm doing the practice, but I'm doing it early in the evening, and then I'm going to bed at like 8:00. So I think really going to bed at 8:00 is really helping. And it's like, okay, yes, and
The second point is similar to what you were talking about in the idea that we're really interested in experience, and people own their own experience. So one of the things that's, I think, powerful is that we have an intention of what kind of experiences we want people to have, and yet It's happening for them, right? So we let go, like you said, of our own patterns and think, okay, in this person's shoes, right? In this, from their perspective, from their lens, what are the kinds of experiences that we want? And then the way I almost feel is we're nudging them, right? Like, yeah, okay, you're going to go in this direction. But so much of it is dictated by them because that's how they have the experience, right? And you know, there's degrees of this, right? You could do a practice with someone and have them drop in and do certain things and have things, right, that are very powerful. And then there's self directed practice, which is different, right? And there are those that need to be directed and there are those that don't. But in the end, it's still their experience, right? That's really powerful. And that was the second point that I think is really important.
Yeah. Let me just follow up with that and say we talk about it in the therapy program as you're empowering people to participate in how they feel and how their mind works, and essentially in their own health, right? So when you get buy-in from someone with yoga, what you're giving them is the power to participate in their own healing, or the capacity to actually change how they feel. And it shows up as a shift in their behavior. And it shows up as a shift in the way that, you know, how much pain they have or how much anxiety that they have, etc. And this is incredibly powerful. You know, that old adage about giving a person a meal versus teaching them to fish. Very powerful. All right, Dr. Birdee, this has been a really nice conversation. Thank you so much for joining us. Any last comments or before we conclude?
It's always fun to talk to you, Chase, and I hope we can continue to have these conversations.
Yeah, me too. I look forward to the next time. All right. Thank you.
Thank you.